This segment of DelmarvaLife is brought to you by Delmarva Dental Services.
So are you one of those that dreads going to the dentist?
Well, according to the American Dental Association, 75% of people have a fear of the dentist, and 10% of those fears turn into phobias.
Now, taking your child to the dentist while they're young can help ease those fears.
In today's Angie's List report, we learn what age you should take your child to the dentist.
I'm gonna be honest with you, when I was a kid, I would always throw up when I went to the dentist, actually. It was pretty much a regular occurrence.
The vast majority of Americans admit to having some fear of going to the dentist, and that's why it's important to introduce your child to the dentist before they have a chance to develop these fears so that they can get used to going to the dentist and feel comfortable. You want to find someone who relates well to children. So whether you're using a family dentist or a pediatric dentist, the key here is finding someone that is gentle, relates well to the kids, and even talks in their language.
Reagan is almost 19 months, and we decided to go ahead and bring her to the dentist at the age of about 12 to 14 months because we went ahead and took her to her pediatrician for a yearly checkup, and they said, hey, you might want to look into going to a dentist, and you know, there are plenty online that specialize in pediatric dentistry.
Some pediatric dentists recommend they start seeing children at 12 months of age and say the first visit shouldn't just be about how to brush your teeth. It should also include nutritional recommendations. And for any of you parents who've cleaned your child's pacifier by putting it in your mouth, don't. Experts say by doing that, you're possibly passing cavity-causing germs to your child.
Well, I think the most important thing for us, too, was that, you know, I didn't think about this, but a parent's dental health is very important too because you can pass things on to her. So, you know, all of a sudden I find myself carrying around more dental floss, trying to brush a little more than I normally do. And being a first-time parent, I find myself brushing quite a bit now, more than I did when I was just a single guy on my own.
All good things to keep in mind.
Yeah. Now, joining us today to elaborate on those tips is Dr. Joseph Harmon with Delmarva Dental Services in Salisbury. Thank you so much for joining us, Dr.
Thanks for having me, Jamie and Lisa.
Now, they just recommended taking your child at a year old.
Yes.
You suggest even sooner than that.
Well, the American Dental Association and the American Academy of Pediatric Dentistry suggests 6 months to 1 year between that time. When their first tooth erupts at around 6 months.
Wow. And a lot of people wait longer than that even. And you're putting your child at risk for some oral problems?
The average age is 3 that a person takes their kid to the dentist.
So why go earlier?
Well, you can eliminate a lot of and prevent a lot of cavities, and also the younger you are, the less fearful you are, the more trusting you are. So you want to discuss diet, you want to discuss fluoride, going to bed with a bottle, avoiding things like that.
Well, even with kids that young, what kind of problem is a cavity going to cause?
Well, cavities can cause pain and suffering. They can interfere with the child's ability to eat,
right.
And they can affect their total health. They can end up in the hospital with a dental infection. Now,
that first visit to the dentist, I mean, it's not like our visit to the dentist. I mean, you really work with the child and the parents?
Now, many times the child will come and sit in the parent's lap. What you're doing is you're slowly getting them familiar with the dentist and the equipment, maybe showing them the light, make them ride in the chair, showing them some of the instruments, maybe looking in their mouth or polishing a tooth. You're not really taking x-rays and things like that. It's kind of a get acquainted. And you do a little bit more every 6 months when they come. You do a little bit more, a little bit more, a little bit more, and then they grow up not being afraid of the dentist. It's a lot easier to do it early than to wait later, because when they're later, they've heard stories from other people and they're more afraid. Right. So the earlier the better.
And then you're also educating the parent at those visits, right?
You're educating the parent because many times the parent can inadvertently scare a child by saying it's not going to hurt, or they can put their fears on the child just by how they act. So the parent sees it's a good visit, and then the parent sees it's a safe environment, and they feel at ease too.
So the baby teeth, they're going to lose the baby teeth eventually.
Yes.
But it's still important to take good care of them because of what they set the road up for.
They hold spaces. If you lose baby teeth early, you'll get crowding. So they hold a space, and that they help their face, help them speak clearly, and they allow child obviously to eat and chew properly.
Right.
They actually shape the baby's face as well.
Yes, they do.
Yeah. Now, diet is important when it comes to our teeth, right?
Yes. Sugar intake, excessive sugar intake, if it's the duration and the frequency of the sugar intake. For instance, if I had a liter of Pepsi and you had 12 ounces of Pepsi, and I drank that liter in 15 minutes and you sipped that 12 ounces for 3 hours, what you did with 12 ounces is worse than what I did.
Because I nursed on it.
Because
I nursed it for so long.
Yes.
Wait, now, they say with kids younger than 3, water, milk only, restrict the juice.
Yeah, apple juice is not only acidic, but it has a lot of sugar. And if you're going to give your child apple juice, it should be diluted. And even milk can cause cavities, especially if you let a child, because it has lactose in it, which is a sugar. Right. Especially if you let them go to bed and sleep with a bottle, which is definitely a no-no.
Don't do that.
And you should take them off the bottle or ease them off the bottle at about 1 year of age.
Yeah. What about toothpaste? We don't want to give our child the same toothpaste we use, right?
No, you want to, first of all, you want to supervise their brushing really till they're about 6 to 9 years old. So you don't really want to let them do it, but you have to kind of go over it. But you want to use a fluoride toothpaste, but you want to use the one that's for a child because it tastes better. And you want to only use about a pea-size amount of toothpaste, not a big, not exactly what we would use.
Please tell me, I am not the only one that's had a problem getting a child to brush his teeth. Is there something I can do?
Well, you have to make it a game. You have to change your toothbrushes. You have to have colorful toothbrushes, maybe an electric toothbrush. You have to change your flavors. Sometimes you make it a game like you're brushing the bellies and the backs of the teeth.
Okay.
And you may want to sing. You have to be inventive, but they go through phases and you have to change it up.
All right. Well, it really comes down to easing people's fears, doesn't it?
Yeah, oh yes it does.
All right.
It's not that tough. Dr. Harmon, thank you so much for the
you.
wonderful information
Appreciate
this
it.
afternoon. Great
Thank you.
stuff there. Well, now, in case you'd like to know more about Delmarva Dental Services, including more on your child's first dental visit, or to download kids' coloring pages to help ease their fears, and who knows, maybe your own too, go to DelmarvaLife.com and click on the Show tab. It's on the left side of the homepage.